Welcome to my channel. I'm Dr. Val Nkendong, a psychiatric mental health nurse practitioner. Today, we're delving into an essential aspect of mental health, emotional intensity. I'll explore what it is, its causes, how it's manifested in various mental health conditions, and, importantly, the treatment options available. This video is designed for anyone seeking to understand the complexities of emotional experiences, whether for personal knowledge, supporting others, or professional development in mental health. Remember, this video is designed for educational purpose and it is not a substitute for professional medical advice. Always consult with your healthcare provider for customized care. Emotional intensity refers to the extent to which individuals experience and respond to emotions. It's a spectrum, with some people feeling emotions deeply and vividly, often accompanied by strong physical and psychological responses. This intensity can be a part of one's inherent personality, but it's also influenced by various factors including genetic predispositions, physiological mechanisms, and environmental influences. Emotional intensity is not inherently problematic. It can lead to profound emotional experiences and a deep sense of empathy. However, for some, it can be overwhelming, leading to difficulties in emotional regulation and heightened responses to stressors. It's this balance between experiencing rich emotions and managing overwhelming ones that is crucial for emotional well-being. In the realm of mental health, emotional intensity is a key feature in several disorders, notably post-traumatic stress disorder, borderline personality disorder, and bipolar disorder. In PTSD, individuals experience intense emotional reactions to trauma-related stimuli, often manifesting as overwhelming fear, anger, or sadness. These intense emotions are a response to traumatic events and are central to the disorder. In borderline personality disorder, emotional intensity is observed through rapid and extreme mood swings and intense emotional reactions to interpersonal dynamics, reflecting challenges in emotional regulation. Bipolar disorder presents a different aspect of emotional intensity characterized by alternating episodes of mania and depression. During manic phases, individuals may experience an intense emotional high, while depressive episodes bring profound emotional lows. Anxiety's relationship with emotional intensity is particularly noteworthy. Anxiety can amplify emotional responses, making them more pronounced and challenging to manage. This amplification is partly due to the amygdala, an almond-shaped structure in our brain responsible for emotional processing. The amygdala acts as an alarm system, triggering emotional responses to perceived threats. In anxiety disorders, this system can become overactive, leading to heightened emotional intensity in response to both threatening and non-threatening stimuli. This overactivity of the amygdala is a key factor in the pathophysiology of anxiety, contributing to the intense emotional responses experienced by those with anxiety disorders. Managing emotional intensity, particularly in the context of these mental health conditions, requires a comprehensive treatment approach. This typically involves a combination of psychotherapy and pharmacotherapy. Let's delve deeper into the specific treatments for each condition, focusing on evidence-based solutions. For anxiety disorders, cognitive behavioral therapy is a cornerstone of treatment. CBT is a form of psychotherapy that helps patients understand the thoughts and feelings that influence behaviors. It is particularly effective in treating anxiety disorders as it enables individuals to identify and challenge irrational fears and beliefs, thereby altering the emotional response facilitated by the amygdala. Medications play a crucial role too. SSRIs, or selective serotonin reuptake inhibitors, are a class of medications commonly used to treat anxiety. They work by increasing levels of serotonin, a neurotransmitter in the brain that affects mood, in the synaptic cleft. By preventing the reabsorption of serotonin, SSRIs help enhance mood and reduce anxiety. Common SSRIs include fluoxetine, sertraline, and citalopram. These medications are generally preferred due to their lower risk of side effects compared to other antidepressants. PTSD treatment often involves specialized forms of psychotherapy. Prolonged exposure therapy, a type of cognitive behavioral therapy, is effective in treating PTSD. It involves repeated, detailed imagining of the trauma in a safe, controlled context to help the person face and gain control of the fear and distress that was overwhelming during the trauma. Eye movement desensitization and reprocessing is another effective treatment. It involves recalling distressing events while receiving bilateral sensory input, such as side-to-side eye movements, to process and integrate traumatic memories, thus reducing their emotional intensity. In terms of medication, SSRIs are often prescribed for PTSD as well, due to their ability to help regulate mood and reduce symptoms of anxiety and depression that often accompany PTSD. For BPD, dialectical behavior therapy is the treatment of choice. DBT is a form of cognitive behavioral therapy that emphasizes the psychosocial aspects of treatment. It teaches patients skills in mindfulness, emotion regulation, interpersonal effectiveness, and distress tolerance. These skills are crucial for individuals with BPD to manage their emotional intensity. Other therapies like schema therapy and mentalization-based treatment are also beneficial. These therapies help patients understand and change unhelpful patterns and improve their ability to perceive and interpret emotions accurately. In the treatment of bipolar disorder, mood stabilizers are often the first line of medication. Lithium is one of the most commonly prescribed mood stabilizers. It helps to even out the mood swings inherent in bipolar disorder. Other medications used include anticonvulsants like valproate and lamotrigine, which also help stabilize mood. Antipsychotics may be used during manic phases to control symptoms. Alongside medication, psychotherapy is vital in the treatment of bipolar disorder. Cognitive behavioral therapy helps individuals identify harmful thought patterns and develop healthier thinking and behaviors. Psychoeducation, which involves teaching individuals about their illness, is also critical. It helps patients recognize early signs of mood swings and adhere to treatment plans. Lifestyle interventions, particularly those focusing on sleep patterns and stress management, are also integral to managing bipolar disorder as they can help stabilize mood swings. In conclusion, understanding emotional intensity and its implications in mental health is crucial. It enables us to empathize with those affected and informs our approach to effective treatment. Each person's experience with emotional intensity and mental health disorders is unique, and so is their path to managing it. If you found this video informative, please consider sharing it with someone who might benefit. Together, we can spread awareness and foster a more understanding and supportive community. Thank you for watching. For more content, don't forget to subscribe.